Hello, I'm Dr. Doug Drevets. I'm the Chief of Infectious Disease at OU Health and a Professor of Medicine in the College of Medicine at University of Oklahoma Health Sciences Center. And I'm here today with April Sanford to talk about the COVID-19 vaccination program. As you all know, after focusing on frontline healthcare workers, the Oklahoma State Health Department recently opened up vaccination clinics to Oklahomans who are 65 years of age and older. This is part of a risk-based strategy to get the limited supplies of vaccine to those who need it most. While most of you probably have a good general idea that COVID-19 is a more severe disease in this age group, I wanted to give you some facts that support this approach. And these are data that come from Oklahoma. Oklahomans aged 65 and over represent only 15% of all cases of COVID-19 in Oklahoma, but they account for 53% of all hospitalizations in the state, so over half. More importantly, they account for 80% of all deaths. So you have this limited number of individuals accounting for a disproportionate numbers of deaths in the state. And that's why we need to focus on individuals in this age group and to try to stem the tide of death and hospitalizations in our state. Interestingly enough, when you put this into context, if you're 35 to 44 years old and you happen to get COVID, you have less than 1 chance out of 10,000 of dying from the infection. But if you're 30 years older than that, in the age group of 65 to 74, your chance of a fatal outcome is nearly 25 times higher than that. Add another 10 years and you're up to 50 to 100 times more likely to die than somebody in their 20s. So you see that age is one of the most powerful risk factors for having a bad outcome to COVID-19. And that really supports what we're doing here, trying to get out vaccine to individuals in that age group.
So this might be something you don't know the answer to because we didn't talk about it, but why are older people more susceptible? I mean, just they have more comorbidities or?
So there are two general ideas as to why folks who are older are more susceptible to having a severe disease. One indeed is more medical comorbidities such as kidney failure, high blood pressure, and diabetes, and indeed severe obesity. But there's another thing, and that probably has to do with the way that your body handles viral infections, particularly new viral infections, and the interferon responses. Older individuals just don't have the same breadth of interferon responses that younger folks do. And so in fact, they tend to probably have a higher buildup of viral load in their lungs before they get sick. More virus means a worse course of disease.
Interesting. So this week we're vaccinating that group. We've started vaccinating that group throughout the state. What have you been on the meetings that would tell you what the next step is? What's next week gonna be like? We're gonna do some like only what 5,000 this week, and then do you know?
Well, we're going to do as many as we can get vaccinations for, and you know, it truly takes a small army of people to put one of these vaccination clinics together and do it in an orderly fashion. And I'm really, you know, proud of our folks here at OU Health for what they've done. And this includes folks in IT who had to build software programs so that you can schedule and register people. Includes folks in pharmacy, both at the hospital and the College of Pharmacy, who have to figure out how to distribute the doses, how to give them. It includes volunteers from College of Nursing, medical students who volunteer their time to actually give vaccines. It takes volunteers to help people find their way from the drop-off site back to where the vaccines are given, just like you're doing, April. You're not medically trained, but you've been at vaccination clinics. You are providing an incredible service for folks. And so it's amazing how many people it takes to pull these things off.
That's very kind of you. What is the next? So this is phase 2 that we're in, is vaccinating the public, the 65 and older. When we've gone through as much of the 65 plus as we can, what are the next steps? What are we looking at?
Okay, so who's next in phases? So you have to remember that each phase is broken down into, you might say, subsets or subphases. There's 2A, 2B, 2C, 2D. And right now, it's 65 and over is, I think, phase 2B, if I remember right. Phase 2A would also be outpatient healthcare workers. So once you get through there, the next groups coming up are, as I understand the program, K through 12 teachers, first responders, and then individuals living in congregate living situations such as shelters, jails, prisons, and the like. And it's important to vaccinate those individuals because they do not have the opportunity to socially distance. Most of the time, they do not have access to masks. A lot of times they don't have access to hand sanitizer and can't wash their hands commonly. So it's important to vaccinate individuals who are at high risk in each of those settings.
So the question that the public is asking us is, when does the average 30-something-year-old with no comorbidities, when does that person get vaccinated?
Well, the short answer is I don't know. That's sort of asking me if what stock is going to go up or who's going to win the next basketball game if it's not immediately obvious. It will probably take several months before we get to the general public. So I am anticipating that will be this summer. But that is just a guess, and it depends on many, many factors. That said, there are 4 million residents in the state of Oklahoma. We want to try to vaccinate at least 3 million of those or more. So even if you do 50,000 vaccinations a week, which is a heroic number, it's going to take time to get there. So we really have a lot of ramping up to do, and it's going to take literally an army of people in pharmacies and doctors' offices and health department offices all over the state to do this.
So right now we have Pfizer and Moderna, and with the other ones coming out, is that going to help? I mean, granted, that doesn't make us have more people to help administer this program, but are we going to start looking at larger doses and numbers of doses getting here pretty quickly? Or?
So my understanding is that because there's been a change in Washington in the strategy of Operation Warp Speed, that Oklahoma will be receiving additional doses next week and the week thereafter, and presumably after that. That'll be a great thing. The trick is going to be being able to register those folks and find individuals who can actually put vaccines into arms.
So we're still, though, at Moderna and Pfizer. Do we have any indication when the EUAs on those other vaccines that are in the works coming out? Or?
Okay, so that's a great question. There are a few other vaccines that have received approvals in other countries. There's an Astra vaccine made by a company called AstraZeneca that recently was approved in the United Kingdom for use. They have not yet applied to the US FDA for approval, and my guess is that they're probably not likely to do that, as their focus is going to be on Europe and then on Africa and different countries in Asia. There's also, I think, 2 vaccines manufactured by the Chinese government that have received approval in China. They have not applied to the US FDA. And the Russians also have a vaccine that they have made, which is now in widespread use. But I do not anticipate that they will apply for approval by the US FDA either. So in this country, the next one that we're likely to get is manufactured by Johnson & Johnson. They are currently conducting a very large phase 3 study in the United States and Mexico. They anticipate that results of that study will be done by the end of this month. If those results show that the vaccine is safe and effective, like the Moderna and the Pfizer vaccine, I would anticipate they would go forward to application to the FDA by early February.
All right, let's get back to the 65 and older. For that senior that's just like, oh, no, I don't know, kind of on the fence about deciding to get the vaccine, what do you say to that person? What should their children, their grandchildren be telling them?
Their grandchildren should be telling them, you know, I want you around for my graduation from high school, for my graduation from college. I want you around to see your great-grandchildren. So you really need to get the vaccine. You know, for somebody in the 65 and upper age group, by and large, it's highly unlikely that you're going to have a bad outcome to the vaccine. You know, the incidence of anaphylaxis to the Pfizer vaccine is about 1 per 100,000. And most of those are in people who have had anaphylaxis to other vaccines or to other products before. So it is extremely unlikely. Your chance of acquiring COVID and dying from that are hundreds, if not thousands of times greater than that. So play the odds and take the 1,000 to 1 chance in your favor.
What kind of we've been giving dose 2 out to healthcare workers. What kind of side effects have you been seeing to that?
Right, that's another great question. So I received my second dose on Friday, and I had a sore arm for a day and a half. I had a headache for a day. I was more fatigued than usual, and one day I was just cranky. But I got through all that in a day or two. As I've talked to my friends and colleagues and others who have had the vaccine, it's pretty much what I expected. Folks who are younger, particularly those who are younger than 40, often they will have some shivering, maybe a low-grade fever, and some muscle aches that night that they've received the vaccine or the day after. Again, these things are easily taken care of by over-the-counter medications such as acetaminophen or ibuprofen. Those of us who are a little bit older than 40 haven't had such exuberant reactions, and it's more the sore arm and the symptoms that I described.
I did have a question from someone asking about if you could talk about new federal guidelines to stop holding back reserving second vaccine doses. And does that have the potential to speed up Oklahoma's vaccine distribution?
So this gets down to a change in strategy by the federal government, which then has downstream effects at the state and the local level. My understanding is that the federal government had been sending out dose 1 to the states as they requested them, but was not yet sending out dose 2. I think the new strategy is to release as much vaccine as possible to the states so they can get it in as many arms as possible. Now, I don't yet know if they're going to relax the guidelines on when you should get dose 2. Right now, we are trying to stay as close as possible to 3 weeks between doses for the Pfizer product and 4 weeks between doses for the Moderna product. Now, there's no hard stop there at the end if you don't get it at that time. And in fact, the United Kingdom goes out to 12 weeks. Our FDA, our CDC, and our NIH have recommended that we keep to the schedule that was studied. And that's because it is helpful in knowing where you're at in terms of your immune response. It's not thought that you will get a complete immune response or have full protection until you get that second dose. And it's somewhat of a time-based strategy as to what's going to get you the most bang for your buck, so to speak. Is it getting more fully immune people or more partially immune people? And that's something that needs to be seen.
So we get vaccinated. When are things going to be normal again? Get your magic ball out, crystal ball out, and tell us.
Oh, jeepers. I wish I knew that exactly. You know, from my perspective, it sort of goes like this. And this is, again, a very personal perspective. So I've had both doses of my vaccine in part because in what I do clinically, I take care of patients with COVID. So I've had both doses of vaccine, and about a week from now, I will have statistically achieved a 95% level of immunity. Now, I hope I'm not in the 5% that does not have immunity and is still susceptible. I don't know that. There's only one way to find out, and I'm not going to go do that. So I will continue to wear my mask when I'm out, and I'm going to continue to socially distance when I'm out. I will probably venture to the gym now for the first time in about a year, but I am going to keep my mask on. What we're looking for on a populational level is when the levels of community spread start going down. Oklahoma has astronomical levels of community spread right now. We have somewhere around 1,000 cases per million residents, so 4,000 new cases a day. This puts us, close to the top of the world, so to speak, in the amount of transmission that we have locally. This number really needs to come down, and I don't have a number that I'm shooting for, but it would be nice to see that down to 1/100th or less of what it is now. Once we get down to a really low level of community spread, I think at that point we can start relaxing some of these guidelines. That might be this summer, it might not be. I'm not sure. There is so much data, there are so many new data coming out about this virus all the time. My expectation is that by the summer, we're going to have a better idea of if we're looking for a resurgence of the virus in the fall or the winter. We'll have a better idea of what our vaccine coverage is. We'll have a better idea of what our numbers of immune people are. Then we can deal with this in a better way.